Welcome to COVID's Lasting Impact, Caring for Immigrant, Migrant, and Asylee Patients, a 10-episode mini-series within Migrant Clinician Network's On the Move podcast, a podcast dedicated to providers who work with vulnerable populations, specifically migrant populations. In this mini-series, MCN provides clinical teams, including community healthcare workers and primary care clinicians, with up-to-date information, expert guidance, resources, and relatable case stories for identifying, treating, and managing COVID and long COVID among U.S.-based immigrant, migrant, asylee, and limited English proficient patients in the outpatient setting. MCN is a national nonprofit with extensive experience providing timely, practical solutions at the intersection of vulnerability, migration, and health. Each episode provides clinicians with impactful tools and information for improving the quality of COVID care for vulnerable populations. If you want to hear future conversations on the topic of health justice, be sure to subscribe to the On the Move podcast. For resources mentioned in today's podcast, be sure to click on the link in our episode notes to go to our podcast page at migrantclinician.org/podcasts.
Well, welcome back to another episode of our mini-series. I'm Dr. Ed Zurawesti. I'm the founding medical director of the Migrant Clinicians Network. And co-hosting again with us on this episode is Dr. Elena Rios. Dr. Rios serves as the president and CEO of the National Hispanic Medical Association, which represents 50,000 Hispanic physicians in the United States. Dr. Rios also serves as president of NHMA's National Hispanic Health Foundation to direct educational and research activities. Welcome back, Dr. Rios.
Thank you, Dr. Zurawesti. I think it's a great pleasure to be helpful in educating more clinicians about our communities. So thank you for having me. Today, we will be discussing how to address COVID-19 and special populations with underlying comorbidities. And I'm very happy to have today with us Dr. Susan Gaeta. Dr. Gaeta graduated from the University of California, Davis School of Medicine in 1998, and she currently works at the Department of Emergency Medicine at the University of Texas MD Anderson Cancer Center, where she does research in sepsis, advanced care planning, emergency medicine, and emergency medical care of cancer patients. She is board certified in internal medicine and is currently pursuing a master's in healthcare transformation at UT Austin. She also has been in 2 different leadership programs. I think it's great to see you, Dr. Gaeta. She was part of our National Hispanic Medical Association Leadership Fellowship in 2022, and also participated in the Center for the Study of Latino Health and Cultures, Accelerating Latinx Leadership cohort of 2023. Dr. Gaeta, welcome.
Thank you. Thank you, Dr. Rios, for that nice introduction, and nice to meet you, Dr. Zurawesti.
So, Dr. Gaeta, we wanted to start with asking you for some examples of day-to-day activities working around patients with COVID and infectious disease specifically.
So as you mentioned, I work for MD Anderson Cancer Center in the Department of Emergency Medicine. And for those who are not aware, we predominantly take care of all our cancer patients, which, they are immunocompromised either because of their cancer or their treatment. So they're definitely at risk for infection. So while most of the United States probably hasn't gone to masking, we're still masking every time we go into work. And then, of course, we're using our protective clothing when we're seeing our patients. And then even within our institution, we're asking our employees and our visitors to still wear a mask when they're in, mixing with different individuals. And then, of course, you don't want to be wearing your mask all the time. So for our patients, if they're in their room by themselves, we ask them, you can take your mask off so that way you can breathe. And then, of course, like any other hospital, we wash our hands before we see our patients, and after we examine the patients, we always wash our hands afterwards. And along with COVID, for us, because our patients are immunocompromised, they're at risk for a lot of infections, and particularly respiratory, along with the flu and the RSV. So we're always kind of having that in a high differential when we're seeing our patients.
Well, that's a great introduction. And we've got several questions we'd like to ask you today, Dr. Gaeta. First of all, can you review some of the symptoms of COVID, which have actually changed over time? You know, we're now in like year 3 of COVID, and some of the symptoms have changed, as well as what the leading recommendations are right now for prevention at this time.
Thank you, Dr. Soresti. That's a great question. So if we go back, to 2021, people were coming in, with I'm having diarrhea, nausea, vomiting, loss of taste or smell. Now, if you fast forward now to 2023 and 2024, what we're seeing is some patients are just coming in with a fever or sore throat. Occasionally, you'll see some coming in with shortness of breath. And then I see patients that come in, at least in my population, fatigue, and, I examine them, and then we get our respiratory swab and they're positive for COVID. And they're like, what do you mean I'm having COVID? So you're seeing, in summary, people with fever, sore throat, but occasionally I'll have someone come in with shortness of breath and cough, which is different than before when it tend to be more multiple symptoms when we initially started the pandemic.
So, Dr. Goethe, I have another question too, is on what are the comorbidities that might make a person more likely to get COVID? And are some populations at higher risk for having certain comorbidities?
Literature shows that if you're age 65 or greater, if you're immunocompromised, and immunocompromised could be from cancer, or there's also other immunocompromised patients, if you have rheumatoid arthritis and you're on treatments. And then going back to the cancer patients, which is what I focus on, if you have a hematological cancer like leukemia versus a solid tumor like a kidney disease, a kidney cancer, you're more at risk with the ones that are hematological cancers. And then also bringing it just to an everyday, if you have diabetes type 1 and type 2, that's a risk factor. And then unfortunately, obesity is a risk factor. And the reason I say unfortunately is because we're seeing data. I take care only adults, but my colleagues in the pediatrics, our kids are having obesity. So they definitely, that is another risk factor for having COVID. And I just want to stress that even though these are risk factors, anybody can COVID, but what's important about these risk factors is these individuals are more at risk for having a severe illness and particularly being hospitalized.
Great. So you've gone over the comorbidities. So my next question is, what kinds of social and environmental factors might lead to higher rates of comorbidities as diabetes and cancers in immigrant and other populations?
So we'll start with immigrant population. When we look at the initial data, what they've noticed is when you're first generation, you're coming into the United States, you don't have as much risk for cancer, but as you get the longer you're in the United States, the second generation, because they start adopting our Western diet, maybe less exercise, they're developing more risk. And then also one of the things that going back to COVID is some of the things how to prevent COVID is you want to mask, you want to do hand hygiene, and then also social distance. So if some of the patients, the public community are immigrants, and if they're living, multiple families in one house, you could think of that's not a much space that you could distance yourself. And then also where the individuals are working, if they're working in the customer service industry, in the hotels, there's a lot of people there. If they're working in the fields, there's a lot of people, and it's kind of hard to kind of distance. So those are all different risk factors that put our community at risk for getting COVID or getting worsening disease from COVID.
So I have another question. We have a lot of immigrants and other populations that are working, laborers in whether it's rural or urban. How might poverty and health insurance access impact these communities?
So that's a great question. So we'll start with poverty. So if you think, if you ever turn on the TV, there's always these commercials with fast food that I think it's like you can get $2 burgers for $1. But then if you go to the grocery store and you could try to get some vegetables. In fact, I was just at the store the other day and it was like apples, it was like $3 a pound. And so when you're short on money, you have to sit there and figure like, how am I going to feed a family of 4? While you may not want to not eat healthy, it's easier to go buy the dollar hamburger versus the, pay for the vegetables. And then some communities, you don't even have access to, healthy food, the food deserts. So that's also a risk, a concern that causes, patients, even though they want to be healthy, they don't have access to it. That's from a poverty perspective. And then from a health insurance perspective, even with our Affordable Care Act insurance, where we have the market pace, if you look into that, I mean, it's expensive to get it. And then it's, high deductible. And then you go, if you're able to get it, then you go to the hospital or the clinic and they're like, we don't take marketplace. So what happens is patients aren't not able to go to the clinics and get, the preventive care, get the, see by a doctor, get screened, and then they end up in the emergency room when they're later advanced because they don't want to go in. I mean, I often talk to my patients like, why did you take 10 days? Well, I was trying to see if I could get better. So those are some of the things that make it worse when you don't have health insurance, and then also with poverty.
Well, great. Well, staying on the social aspects, our next question is, do you think structural racism and its impacts like mistrust of the system has impacted health outcomes for people at higher risk for COVID?
So yes, if you think back and, both in the African-American and Latino communities, there is a lot of structural racism, a lot of mistrust in the healthcare system. There's been a lot published on the concerns. And so now you have us, the clinicians and, are telling our patients, come, get screened for COVID, get these vaccines, get tested for colon cancer, all these different things. And if the trust is not there, they're not going to want to believe you because, and then of course the media doesn't help because it's like, oh, doctors are getting rich with, prescribing vaccines, prescribing this. So it's definitely has an effect of the trust is not there. So we need to build that trust with our patients.
So, I think it's important to build trust, and we do know that doctors especially are very trusted, especially for families that do have access to health care. But how would you recommend doctors talk to patients and community members who are actually hesitant to get the vaccine? And what role do you feel community health workers have in this process as another part of the strategy?
Thank you, Dr. Rees. That's a great question. And I was sitting here reflecting. I remember actually one of my co-workers, she was one of our nurses aide, came to me and she's like, Dr. Greta, I know you're always talking about COVID vaccine, how it's important. She goes, but I'm scared. So what I would say is listen to where the patients are at. And so I asked her, I said, why are you scared? She goes, well, I've heard that if I get my COVID vaccine, I'm going to die. I said, well, let's unpack that. So I think that's the main thing. And the message I would say is listen to them and see what their concerns are. Why are they hesitant? What they've heard. And, taking that time to see where they're at. And you don't want to just say, I'm the doctor, you need to take the COVID vaccine. That's not the way you built the trust and the relationship. So I think that's what I would recommend is listen to them and ask them, why they're hesitant. And it might take a couple of visits, a couple of conversations. And, for my colleague, she came back to me a couple of months later. She's like, I took the vaccine. And I said, okay, good. I said, and you were okay? You didn't die? She's like, no. I said, so share that with your colleagues and your friends. So I think that's how we get our patients to listen to us. And then as far as the community health workers, I mean, I can't speak a lot about them. I mean, they are helpful, they're out in the community. And one of the things that I enjoy about the community health workers is they're there talking to the community and asking, what is it their concerns about? And then they're taking that either to myself or someone else and say, I spoke to this group, this is what they're concerned about. And so we talk to them, and then also providing that information for the community health workers. I mean, they're our strongest advocate. They're out there in the community and saying, this is helpful for you.
I'm glad you brought up the community health workers because this podcast goes out and is viewed by a lot of community health workers and a lot of frontline providers. So my next question is, what are some treatments now that the community health workers and other clinicians should be aware of, and they should be telling their community members about when it's regard to testing and or actually if they become positive for COVID? what are some of those pearls we need to have our community health workers know and our clinicians know when they're talking to the community?
So we'll start with testing. I think my recommendation and looking at the literature is if you think you have COVID, get tested. I know initially, we were getting, the government was sending COVID samples, tests, to your house. And I know recently they restarted again. So get tested if you're concerned. And then of course people say, well, I can't afford it. And so you're always, the recommendation is to get tested, but if you're not able to get tested, kind of separate yourself for 5 days to try to get better if you're not getting tested. So definitely get tested. Avoid large crowds. As far as testing for treatment, it's divided in two groups, adults and children. And so there's currently right now 3 main treatments at the moment based on the current variants of the COVID virus that's out there. So the first one that is Paxlovid, and this is recommended for adult and children of age 12 and older. One of the things about this drug is there's a lot of drug-drug interactions. And so while it helps to prevent worsening disease of COVID, there's always, when the prescriber is going to prescribe this medication to the person, you want to make sure that they review what medications they're on and make sure there's no drug-drug interactions. And then see if there is a drug interaction, can you hold that medication while you're giving the Paxlovid? So that's the main recommended treatment. Now, because there is a lot of drug-drug interactions, there is a second agent. However, this is only recommended for adults, and it's called Malpigavir, and the brand name is Lagevrio, Lageviro. Again, both of these, Paxlovid and Malpigavir, are oral agents, and the recommendation is to give these for patients who are high risk of getting complications from COVID. So the patients that we've been talking about that are at risk, this is where you would treat it. Now, if you're not able to get these oral agents, or if the patient is needing to come into the hospital, then there is one IV agent called remdesivir. There is some hospitals that are giving this as an outpatient, but you have to keep in mind that it's a 3-day infusion. So you would have to go into the clinic to have it done on 3 separate days. It is approved for adults and children. And then of course, if you come into the hospital, and sometimes we do hospitalize our patients and we give that as an IV formulation. Again, all these 3 agents are only recommended for patients who are at high risk.
So I think, we've heard a lot about the importance of continuing to be on the alert for clinicians and community workers who are in contact with patients who are sick, and to consider COVID-19 as still a virus that is plaguing our communities, especially our poor communities and undocumented communities, immigrant communities who may not have the access to health care. And you may see them in your community clinics. And I think it's important that we heard from Dr. Gaeta the importance of getting tested, the importance of being educated about being separated from other people, not being in crowds, and also the importance of that there are treatments available now for people to be aware of. And I think what's important also is that there's so many different immunocompromised patients out there that don't even realize that they could get worsened COVID or long COVID. And we all need as a medical community and community health worker community to be aware of letting others know about the importance of these patients so that we can get care for them. And I know that it's hard without insurance, but I think the community health centers, especially in our rural areas, the migrant clinician centers, for example, are a place to have access to care because they take care of everyone that they can. And I think Dr. Zaristi, you could tell us more about the challenges, but I think there's a real opportunity for educating more of our clinicians and community health workers, not just doctors, about the importance of educating people about the importance of getting care, especially when you have comorbidities already, and are whether it's cancer, like the patients that Dr. Gaeta sees, or other immunocompromised, and even being over the age of 65, and having more chronic diseases that you may not be aware have can substantially give you the chances of having worse COVID. So I think that we learned a lot from you today, Dr. Galletta, and I think it's important to, thank you for all your knowledge, and good luck with all your continued education of your patients and the community health workers you work with. I know you're doing a great job.
Yeah, I think Dr. Rios just summarized very well what this podcast was all about. And I think as we're, 2024, COVID will still be with us. We were all hoping it was going to be gone in a year or two, but it's still with us in 2024. So we need to be prepared for that. And I think the emphasis to me is that we need to work with those community health workers who are the trusted messengers for the communities, and make sure that they're educated so that when they go out in the communities, they let the community know that COVID is still an issue, but there are resources for them at community and migrant health centers all over the country. Whether you're documented, undocumented, it doesn't matter. Whether you can pay or not pay, it doesn't matter. There's sliding fee scales for community health centers, so that there should be access for testing and treatment for all patients in the United States. And so with that, I want to thank Dr. Galletta again. And there are resources for this episode, including a recording of the webinar is on this topic, can be found through the link in the notes section of the episode.
And I just wanted to mention that National Hispanic Medical Association has resources also that you should be aware of in English and in Spanish for our communities at www.hispanichealth.info. That's Hispanic Health, one word, .info. And we also partner with the Centers for Disease Control and Prevention in our Vaccinate for All campaign. We have another website, vaccinateforall.org. And I'll just share a couple things about our programs to help more doctors out there and others who want to become leaders. We have two programs right now. One is the Hispanic Leadership Development Fellowship, funded by the Office of Minority Health. This is for students in master's programs, master's graduate degree programs, or graduates within the last 2 years of your master's program. And we've had one cohort already. We're about to have 3 different cohorts. These are students that are interested in coming to Washington, D.C. to work for 9 months at the U.S. Department of Health and Human Services. We provide mentoring from Hispanic employees at HHS. We also provide webinars like this with speakers who are experienced in leadership and also with public health. And we're very concerned about the importance of having more leaders within HHS that are Hispanic, especially. The second program we have is actually our Leadership Fellowship that Dr. Galletta was a part of. We now have a program really focused on California right for the moment. The California Leadership Fellowship of our National Hispanic Health Foundation. That program is, we're looking for 10 doctors who work in California interested in learning more about public health in the state and also at the national level, again, to advance careers so that we can help develop more programs and policies with migrant centers, with community health centers, and with our public health in general to be able to help our communities through not only webinars like this, but policy positions and programs where they can get into public health and help us make changes in our communities for the good of all Americans. So thank you very much.
And we want to thank our listeners for joining us today and to speak with Dr. Galletta. And we want to thank you, Dr. Galletta, for taking time. I know you're very busy out of your schedule to come and speak with us today. Your knowledge is very important to us. So thank you, Dr. Galletta.
Thank you, Dr. Suresti, for the invitation, and Dr. Rios. I just wanted to say in closing, I know we've been focusing on COVID, but along with COVID, it's flu season, RSV. So please get vaccinated for flu and RSV if you meet the criteria so we can take care of everybody.
That's great. That's a very good recommendation. And thank
Yeah.
you again, Dr. Rios, for co-hosting again this episode. We really appreciate you taking your time. We know you're very busy out of your schedule to come and help co-host this for us. Thank you very much.
No, and thank you, Dr. Rusty, for inviting me, and Dr. Gaeta for being a great speaker. Just to let you know, we actually have the National Hispanic Medical Association website is nhmamd.org. And our California Leadership Fellowship that I mentioned is actually under our National Hispanic Health Foundation. That website is nhmafoundation.org. And you can see more resources and activities that we're involved with to help our communities. Thank you very much.
And I think if you want to get in touch with Dr. Gaeta, for those of you who are on now, she's on LinkedIn at Susan Gaeta, that's GAETA, and you can email her at susgaeta@gmail.com.
I'd also like to let everyone know that I'm also available on social media, especially with Twitter and Instagram, and also Facebook and LinkedIn. And it's Elena Rios, MD. Thank you.
And for all of these links will be listed in our episode notes for more expert guidance and tools to improve the quality of COVID care for vulnerable populations. Follow our podcast, On the Move with MCN, and come back and listen again. So thank you very much, everyone.
Thank you, everybody.
Thank you. Thank you.
To access resources mentioned in today's podcast, click on the link in our notes section to go to our podcast page at migrantclinician.org/podcasts. Visit migrantclinician.org/sign up to join our email list and subscribe to our blog to get updates on new MCN podcasts, resources, and webinars. Migrant Clinicians Network is a national nonprofit dedicated to providing practical solutions at the intersection of vulnerability, migration, and health. We offer technical assistance, health provider capacity building, resource development, research and data and evaluation support, and virtual case management for mobile populations, and free resources and training. The information in this podcast is for trained healthcare professional education only. Information should only be used in combination with up-to-date national and international guidelines. The information is not to be used as healthcare advice for the general public.